So thank you, Michelle. So I would now like to invite Gillian Moore, who's from the Hermitage Clinic, up for the next presentation. Gillian is Acting Radiotherapy Services Manager at the Hermitage. She has previous experience in both the public and private sectors, with over 20 years' experience in oncology clinical and management. Gillian, I believe, has been involved right from the start with the introduction of the CyberKnife technology to Ireland, which is the topic she will talk on today. Thank you, Gillian. And I should mention the time prompt is just there in front, if you don't mind.
Thank you. Good afternoon, everybody. Firstly, I want to thank the PHA for inviting the Hermitage to discuss with you and tell you all about one of our latest innovations. It's been a massive privilege for me to be involved in the introduction of the CyberKnife to Ireland. It's one of the greatest weapons, I believe, in the war against cancer, and it'll definitely be a lot more prominent in the future. So quick overview, I'm going to introduce our unit at the Hermitage, what can be treated, what have we treated, how does it work, and the tracking systems that it uses. So this is our baby. Well, it was a baby in 2013, now a toddler. We're up and running 3.5 years. And this is day one, our first patient that we treated. He actually was a patient who had an inner ear tumor, who had a very bad experience with surgery and had to have further treatment, and they recommended he should have further surgery, and he declined and decided to wait for the CyberKnife to be opened at the Hermitage Clinic. So what exactly is CyberKnife? So it's a robotic radiosurgery system. It's the world's first intelligent robotic radiosurgery system designed to treat tumors, cancerous and non-cancerous, anywhere in the body. It can detect movement of the tumor, or it can detect movement of the patient throughout the treatment with less than 1 millimeter accuracy. So it delivers high-dose pencil beams of radiation with pinpoint accuracy. Because it can deliver radiation beams from virtually any angle and any direction, and it means that the radiation beams can be more precisely focused on the tumor, and then therefore minimizing damage and collateral damage to surrounding healthy tissue. Each treatment delivery is normally about 200 beams, as the dose is gradually painted onto the target. So if you can see from this image here, you can see that the treatment is non-coplanar, so the beams can be delivered from any angle. You can target in areas that you don't want to treat, and then guide the robot to avoid certain areas that you don't want any radiation delivered to. And then this here is just showing you the non-isocentric beam delivery, which is a conventional type of treatment, would be isocentric, where the dose is just gradually painted onto the tumor. Again, this just shows you over here is conventional treatment, where it's coplanar, so the treatment is restricted to certain angles, whereas over here with CyberKnife you can deliver from virtually any angle, avoiding critical structures such as optic chiasm or nerves in the eyes, or any critical structures within the body. So what is CyberKnife? It's non-invasive. It provides pain-free, non-surgical option for patients who have inoperable brain tumors, or surgically complex tumors, or patients unsuitable for surgery, or patients who don't want surgery, who refuse surgery. The treatment is delivered over 1 to 5 treatments, as opposed to 5 weeks of treatment. There's no anesthetic, no infection. It's completely pain-free. And it's an outpatient procedure with little or no recovery time. Massive improvement in quality of life for patients. For example, prostate patients, we can treat them within 5 days, whereas normal radiotherapy treatment would be delivered over 7 to 9 weeks of treatment, with a treatment every day. So what can be treated? The list is pretty extensive. At the moment, we're not treating everything, but we can treat a lot. The limiting factors would be the patient status and the size of the tumor. What are we treating at the Hermitage? Intracranial, spinal tumors. We started lung tumors this year. Soft tissue, such as liver. We treated our first liver last month. And prostate tumors. So we started off in 2013, and we did the basics. We started with the simple things, which were all intracranial stuff. Then 6 months later, we moved on to prostate and spinal tumors, primary spinal and secondary tumors. And then this year, we started lung and liver. And We've treated 2 lung patients and 1 liver, so it's very early days for those, but hopefully we'll be moving on pretty quickly. The numbers to date, we've treated 455 patients. I could count on one hand the amount of patients that had any major side effects or major problems following treatment. The commonest, approximately 25% of patients would be acoustic neuromas, trigeminal neuralgia, meningioma patients, and brain metastases. So where did it come from? So this guy, John Adler, is an American neurosurgeon, and he was in San Francisco, and he was wondering how one day he was looking at the Bay Bridge, and he could see them x-raying the Bay Bridge in San Francisco, and he thought, why can't I have a mini x-ray machine so I can treat my patients who are not suitable for surgery? And then he came up with the idea of attaching this mini radiotherapy unit to a robot, a KUKA robot. And these robots are found all over car manufacturing plants, Ford, GM, Chrysler, whatever. They're found putting cars together on massive manufacturing plants. And they have precision accuracy of less than 0.6 of a millimeter. So it was invented over a period of 10 years and was approved by the FDA in 2001. And by 2010, there was more than 100,000 patients treated worldwide. I'm kind of going to go a little bit fast now because I'm running behind. So what exactly is it? So we have here the robot. This is the robot. Attached to the robot is a tiny little linear accelerator, which is a radiotherapy treatment machine. And then embedded into the floor image detectors and on the ceiling 2 X-ray sources where we can track and detect for patient movement. So the treatment delivery, so the ability to track the tumour or the structure and to enable an accurate treatment. Conventional treatments, we would use what we call a LINAC-based treatment machine. And to make sure that all the organs are in where we think they are, we would take an image, which would be a cone beam. It's like a CT image of the patient. This can take 2 minutes. That can take 2 minutes to review, and then to correct can take 2 minutes. Whereas with CyberKnife, it basically corrects every 15 seconds. We take an image with those cameras. Sorry, with CyberKnife, it real-time corrects, so it takes an image and immediately the robot will know, actually, I need to be 0.5 of a mil this way or 0.5 of a mil that way, and immediately it will correct for the movement. So the whole system is based on tracking systems, imaging software that use the anatomy to track the position of whichever organ we're treating. So we have skull tracking, fiducial tracking, like for prostate, where we'll insert some little fiducials into the prostate, and the robot will lock onto those, and will treat the prostate as the patient's lying on the bed. Or for example, lung tumors. Sorry, I keep going back the wrong way. So lung tumors, it'll lock onto the lung tumor and it will actually treat the lung tumor as the patient is breathing. The patient is not restricted from breathing. There's no breath hold involved. There's no anesthetics. They just lie on the couch and we tell the robot what to lock onto. It locks onto the lung tumor and then will move with the tumor. And then spine tracking. So this just goes through each section. So the skull tracking, it uses an algorithm whereby it uses X-rays and hand spool units to make sure it knows where the skull is and what type of movement needs to be made to allow the robot to correct for any movement within the patient. For prostates, then we insert little gold seeds into the prostate, or for a lung tumor, we might insert a gold fiducial into the lung tumor to get the robot to lock onto it. And so spine tracking, again, it uses a similar algorithm to the skull tracking, where it compares bone densities and locks onto the actual bones of the spine. And then the lung tracking was introduced by Accuray by CyberKnife in 2006. It's the latest technology with CyberKnife, and that's where it will lock onto the actual tumor of the lung and treat while the patient is breathing. And this just shows you an example of conventional treatment over here. The dose splashes from the radiation to the rest of the skull. The middle treatment would be the most modern type of treatment that's available in Ireland. And then here with CyberKnife, you can see the collateral damage or the dose to the rest of the head from an acoustic neuroma patient, which is an inner ear tumor. So summary, that's the latest in the armory against cancer. Completely non-invasive, provides pain-free, non-surgical option for patients. 1 to 5 treatments, no anesthetic risk, no infection risk, completely outpatient procedure with improved quality of life. 1 to 5 treatments with versus 6 to 8 weeks of treatment. That's just showing you a little video of how it works. So this will be very quick. I know I've gone over. So just a CT scan, and then we digitally reconstruct images at certain angles. Then take virtual projections on, and these virtual projections are used then for the positioning during treatment. So then the tumour is outlined on these. So then on the left-hand screen you have your actual treatment position that you need to be in. Then on the day of treatment, it takes a picture, and then we would make sure that one correlates to the other, they both match. They are overlaid on the last screen, and then once we're happy with the position of the tumour and the position of the patient, then we go ahead with the treatment delivery. We've attached 3 little LED monitors onto the patient's chest so that the robot can actually track the tumour while the patient's breathing. You can see the robot actually moving there while the patient's treatment is being delivered. And that's it. Thank you very much. Thank you.